am Dr. Vijayakumar Narayanan. I did my basic medical graduation from Kerala, South India. Sometimes I ask myself how these patients are getting better results than even the Caucasian or the Asian population. Genetically, they are gifted. That is what I should say. I don't have any data to substantiate my argument, but still, from my feeling, what I have seen is if I give any toxic chemotherapy, if I send the patient back home, and maybe 2 weeks or 3 weeks later, when I suggest them to come back, they come so smiling, and then they are willing to get the next job as well. So this kind of a God-given gift is there for the African population. That is why I think the results are better than any other population. I don't have a data to substantiate my argument. I am just telling that one. But now we are engaging in some kind of meaningful research as well. We are trying to get treatments that is trying to domesticate the Western guidelines according to the capability or the affordability of our population. See, whenever we deal with any chronic illnesses, there are a few points that you need to know. One is that is called appropriate technology. When a patient is sitting in front of me who is finding it difficult even to find ways to mend their own daily routine, and if I am suggesting them a highly sophisticated or a delicate chemotherapy like monoclonal antibody or a molecular treatment modalities and all, that is useless. I should say that is futile. There is no need for talking like that. So we need to identify an optimum type of chemotherapy that is affordable and accessible and patient friendly and pocket friendly. So my treatment, I always design all the treatment based on the pocket size of the patient who is sitting in front of me. Though I'll try my level best to stick on to the available guidelines, but most of the treatment I usually domesticate. This is called appropriate technology. That is appropriate to the existing society. Then the another point that we need to think is equitable distribution. When we offer the healthcare system to everybody, the distribution, the wealth distribution should be somewhat equitable. But you can see the economy in Kenya is too much skewed. We have the haves and the have-nots. There are people who can afford once in 3 week chemotherapy. They can even fly to UK or US or India once in 3 weeks. But there are people who cannot even commute in a just a simple matatu from Moranga County to Nairobi. There are people like that. So we need to balance in between. This equitable distribution is not, that is political. I'm just putting one point into your, for your discussion or your thinking. So appropriate technology, equitable distribution, these are some of the things that are challenging in the healthcare delivery as such in Kenya. Now coming about a few questions that you are asking, one, what is breast cancer? What are the main cancers that we are dealing here? For the women, of course, the number one cancer that we are dealing here is the breast cancer. As I told you, breast cancer, if we get the breast cancer in an early stage, whatever be the type, is it ductal carcinoma or lobular carcinoma or serous or mucinous, whatever it is, the results are really good. But unfortunately, we don't usually get early stage breast cancers. Our cases are coming at a very later stage. Thank you for joining with me for this discussion on cancer, especially the breast cancer and prostate cancer. I'm an oncologist, and you can book my services through ponea.com. And ponea.com is a wonderful service provider for different specialties of medicine. And you can access my oncology services through ponea.com. Thank you very much.